Officer in the Special Needs Assistance Programs Office at HUD headquarters in Washington. Thank you everybody for joining us in our second of our summer training series for HMIS leads and system admins. As you see on the screen, this is the second training. We will be talking primarily today about reporting from HMIS. I have on this call or this webinar with me 3 of our national HMIS technical assistance providers. Joel Remigio and Dan Fox are both with the Cloudburst group. They've helped to set up the webinar and will be doing some of the things on the back end. You'll hear from Dan in a minute just about some administrative things for the webinar on answering questions, asking questions, things like that. And Michelle Budzek, who's with the Partnership Center out of Cincinnati, Ohio, is another one of our national HMIS TA providers, and she's going to be doing the bulk of the presenting today, so we'll be handing it over to her very shortly. So I just want to welcome everybody, thank everybody for taking time out of their afternoon. Hopefully this will be helpful for you all, and I'm going to hand it over to Dan so he can go over just a couple of administrative things about asking questions during the webinar.
Thanks, Karen. Afternoon, everyone. So I just want to, actually I'll go to the next slide here. Really, I'm just going to cover submitting questions. Because we have so many people on the phone today, we're not going to open up the lines for Q&A just because it'll be too chaotic. So in the GoToWebinar functionality, there is Q&A function, and please use that instead of the chat function so that we can track the questions and answer them more efficiently. Some of us will be answering questions in the background while Michelle's presenting. If you have a more specific question where you need guidance related here today, but that's more specific to your community, please make sure to use the Ask a Question feature so that you can get that individualized response. And if you forget the link, I know you can't access the link at the moment. If you forget the link has been placed in the chat box. So with that, I'm going to hand it over to you, Michelle.
Thanks, Dan. Good afternoon, everyone. We're going to take a look today at a variety of reporting modalities that are used in HMIS and to help you understand a little bit better maybe what's coming up with each one of the different kind of reports. And we're going to start with the Continuum of Care APR, which should be a very familiar report to an HMIS system admin. And we're talking here about the project reports, not the HMIS APR, but the permanent housing, transitional housing APRs. The report has been updated. The HMIS APR is not going to undergo an update, but except for the data quality question. But the rest of the questions in the full APR have been updated. You will see it looks very much the same as it has looked in the past. And our hope at HUD was to be able to release it at the start of the federal fiscal year, October 2015. eSNAPS is not programmed yet to accept the new APR, and so your grantees will continue to submit the old APR until the time that eSNAPS is updated, which we're hoping for November. Realistically is probably the beginning of January. So HUD will send out a listserv when eSNAPS is ready to take that, and until that time you would have your projects reporting out of HMIS, reporting on the old or the current APR. The next slide. The APR changes that are coming forward in the new APR include the following things. We've renumbered the questions. They're in consecutive order now. There shouldn't be a bunch of skips on the question pattern. However, some projects, of course, don't answer certain questions, so you would still get a skip pattern because of that. Q4 has been added, which is a project descriptor data element question. So for the first time, the APR is going to show what you as system administrators set this project up as. What's the name of the project? What's the organization of the project? What's the project number in HMIS, and what kind of project type is it? So for the first time, the APR will show the project type. We're hoping that that's going to help both you and the grantee understand what and make sure that everything's in line and correct on project typing, because as you know, the project typing is critical for your being able to do system-wide performance measures and other kinds of things. So this is just one way to help you with that. We have created a question Q6 that I'm going to show you in a minute. That's a report validation. All of the validations in eSNAPs will validate back to the answers in Q6. So if you've helped anybody do an APR in the past, you would know that we were validating to things all over the place in the APR, and hopefully that'll stop now and they'll all be validating to the answers in Q6. The universe of respondents for questions has changed. They're all updated to the universe of people that are supposed to be answering the questions in an HMIS according to the data standards. So the universe is reflective of what you'll see in the data manual or data dictionary. And the APR now has 3 subsections. A subsection for youth and veterans and chronic homelessness. If we take a look at question 6A, you're going to see that for the first time we have the validation tables, but they also serve for you as sysadmins as a snapshot of what's really going on in that project. And for those of you that can run questions without running the whole report out of your APR, Q6 will offer you the ability to run questions like how many people do we have in shelter at a given period of time, or how many people do we have in transitional housing in a given period of time, by running Q6. So total persons being served maybe over a month or over a quarter if you're trying to look at how to use your HMIS reports currently programmed in your system without having to go to the vendors and ask for additional reports. How can you use those existing reports to really get out some of the information that you need or that your continuum needs for planning or for performance quality kind of measures. So Q6 is a nice, handy tool for that. We think you'll find it useful for other things. The new subsections of the APR are veterans, chronic, and youth. So essentially what happens here is if the project has served one person that falls in a subsection category, so they've served one vet or one chronically homeless person or one youth, then the subsection in eSNAPs will open up and they'll have to answer all of the screens on that subpopulation. So we get the total population of the total person served in the project. The subsection is going to have the total number of vets served in the project by household type, by age, by race, by gender, so that there's a whole subsection part for veterans. If they serve veterans, youth, and homeless, then all 3 subsections are going to open up. That's all controlled off of that first Q3 question in eSNAPs, where they specifically ask you, do you do this? Have you served any of these people? And at that point, those forms will be visible in eSNAPs for the grantees to fill in. A veteran has to be a person age 18 or older. at the time of project entry or report start date, whichever is greater, and has to have a yes indicated for veteran status. The chronic homeless definition will be published, not definition, but the schema, the programming standards for which chronic homelessness is pulled will be updated to the new 3.17 data element. But three things make up how a person is identified in an HMIS as chronically homeless now, right? They came from the streets or the shelters. There's a formula to use those length of time indicators that are in element 3.17, and they have to have a disabling condition. So nothing about the definition that you know has changed. Those three elements still stand, and there are programming specifications to tell vendors how to pull chronic homelessness out of the system. The youth subset of tables in question 27 are all the youth questions. Youth for this purpose is any client aged 12 to 24. I know that as you've tried to put your RHY providers on and have listened to other kinds of conversations going on about HMIS or about COCs, that youth often takes different definitions depending on who is defining it or who is describing it or what they're trying to look for. For the purposes of the APR, they are any client who's aged 12 to 24 that does not have a household member with them over that age range. So they might have children. They might be youth with kids, teen parents. Those would count in the formula, but who wouldn't count would be a teenager that was presenting with her mom. So we're finished with the APR. Are there questions that I should deal with? Okay, they're saying keep going. So the ESG CAPER is probably the biggest change in reporting that you're going to see coming at you this year. It's a totally different way to take a look at the information coming out of our shelter system and the other projects that ESG funds. There are tables for the ESG CAPER that are identical, except for one, to the APR tables. There are not as many tables, but they're the same type of tables. So all of the tables will look at, just like the APR does, look at households with children, households without children, persons in unknown household types. They'll all be in that kind of grid and totaling up and summing up. And so it won't just be a number. In the past, ESG has often reported a number of homeless people served by a project. We'll now be showing not only the number, but the detail in the number. Vendors have been provided with programming specifications. Those are also posted for you on the HUD Exchange. Vendors have been provided with all the table shelves and with the CSV extraction instructions. So how the CAPER is going to work is different than you're used to. But let's first talk about how the CAPER is set up and who reports what. If you recall, if you were on our series when we talked about ESG reporting or ESG program setup in your project setups in your HMIS, we're going to come all the way back full circle to that project setup. An emergency shelter set up either as a night-by-night data collection method or an entry-exit data collection method in your HMIS will be reporting information on everybody housed to ESG. So just to remind you and to be clear, in the emergency shelter component of ESG, they could be funding operations. They could be paying for the light bill. They could fund essential services. They could be paying for a case manager or a case aide. They could be funding renovation. They could provide day shelter services. In each case, the project is reporting out of an emergency shelter, either a night-by-night method or emergency shelter entry-exit method, or in the cases that it's strictly a day shelter, they would be using a day shelter project type. Everybody that's served in those project types is reported in the APR. So they don't have to separate the ESG funded beds from the non-ESG funded beds or worry about which person got case management from the ESG funded case manager. If the shelter provides case management, everybody in the shelter is going to show up in the report. If the shelter got funded for operations, services, and renovation all in the same fiscal year, they only need to provide one report. The report on the total shelter, the total number of people served. We don't need the same report coming in for operations and services and renovation. Just one will do it. If the project was a grandfathered transitional housing project that was funded under emergency shelter, it's going to come out showing an HMIS project type as transitional housing, and that's okay. And again, we're going to pull anybody that was funded in that was provided housing for in that transitional housing project is going to show up in the ESG CAPER report. Homelessness prevention should be all those persons that are served in prevention, and I'm sure locally you have some kind of definition about what does that mean. At what point do you start data entry into your HMIS? At whatever point you start data entry into your HMIS, which is generally when the person has been determined to be in some way eligible for participation in the project, in the homeless prevention project, then all of those persons, whether you gave them funding or gave them services or not, would actually show up in your homelessness prevention report. Rapid rehousing is the same thing. We're going to pick up the rapid rehousing people pre-housing before that entry into housing date. As of the date that they started participating in the program, if they were in a shelter and they were participating in RRH and the RRH worker was helping them get into housing, and then later they got into housing, they're going to count. If they were in a shelter and the RRH worker was helping them and they never got into housing, that's going to count too. So all of those things are going to come out in this report. The report is using a new tool called eCart, and eCart is a data import kind of tool. You'll see the table shell on the screen, if you can actually see it on your screen. It is a table shell that looks just like the APR table shell. It shows you, the persons that were served by household type and then totals them all down. What happens with ESG reporting is that CSV specifications have been provided to vendors to pick up the information in the cell and export it via CSV, put it into a CSV file for export. So the CSV file would actually read the 13,955 total. A CSV is a comma separated value, comma, 11,600 without children, comma, 2355, comma, 0, comma, 0. It flattens all that information and brings it in. Each question in the CAPER will have its own CSV table that is to be filled out via this export. The information then gets emailed to the jurisdiction by the grantee, so by the subrecipient they call them. So the subrecipient is the shelter. They've received ESG funding to turn on the light bill. They've run their CAPER on their screen. They've pressed, instead of pressing print, they're pressing a button for a CSV export. That export comes out and it's in a zipped file. Everything's all together. According to the specifications, it should come out right out in a zip file, and they email that zipped file on into the city or the county or the state, whoever is the ESG grantee. When the ESG grantee gets the zip file, they're going to open it up, and the data is actually going to flatten out and look like this across the screen, and it's going to sum up the answers. So each green row in the eCard tool is its own project. So each shelter has its own line. There might be a line for a shelter and a line for an RH and a line for a TH, all on the same worksheet. And eCart will sum up the numbers up into that yellow column. Then eCart has a slicer to enable the grant recipient to look at the data in a whole bunch of different ways. So they can look at it by project type. They can just select all the projects that are typed emergency shelter in the HMIS and look at the totals for that. They can look at it by project, by an individual project. They can look at a report that says, what did shelter XYZ specifically do? They can look at it by organization names. So if one organization has 6 projects under it, they can look at all the people that that organization served. eCard is a tool that will be made available on the HMIS or the HUD exchange under the HMIS section and probably the ESG section. And it might be a tool that you as system administrators would also find useful for other things. This gives you, again, the ability to slice and dice some information that you get out of your HMIS system in ways that perhaps you didn't have your vendor being able to provide it to you for. So we will have some extensive online webinar training on how to use the eCard tool, both for grantees to be able to use it better, but also for you as system administrators to understand how the tool actually functions and how the report functionality works. eCard is a locked tool. It is not an open, it's an Excel spreadsheet. It's really not anything all that fancy. It's an Excel spreadsheet with some locked programming into it. In the actual guidebook is the code to unlock the eCard tool for you as system administrators who might want to be able to use the data that's being exported into eCard for other kinds of things. We give you the ability to unlock it so that you can use it however you want to use it. We've locked it so people don't accidentally make data entry mistakes and change a CSV imported value. But we understand that that oftentimes you as system administrators struggle for different kinds of ways to look at the same information, and this might be one tool that you'll find useful at some point. We hope so. That ends ESG. Are we?
There were a couple of, I think, more technical questions about, do we have to use the CSV schema for e-cards? I'm trying to think what other general.
You don't use the CSV schema for ESG CAPER. It's just for these tables.
But it is a CSV export.
It is a CSV export. It's not XML. Yes, you have to use CSV, and yes, it has to be to this ESG schema. This does not take client-level data like you're using. So it does not have a way to make manual corrections. There will be an error tolerance level that HUD will issue when eCart gets released. It'll come out with a guide, and in that guide, HUD is now determining at what point can there be errors. So the kinds of validations in eCart are, for example, the number of people that have an age or no age or don't know refused equals the total number of people served in the project. They're not intense validations. They're the basic kinds of validations that you would normally use. You know, everybody has to have a sex. Everybody has to have a race. Everybody has to have an age. Those kinds of validations. But there is an understanding by HUD that this is the first time that emergency shelters, especially, are going to be bringing in data at this kind of level, and that there is still a learning curve on this whole thing. So there's going to be a tolerance level that they'll articulate to you. eCart has a tab in it that actually shows you the errors and highlights every time there's a validation error. It will highlight the cell that the validation error is in, so you actually know where it is, and it will show you the error tolerance level that's there for it. Okay, let's go on to regular CSV reporting then. You, I know, are used to CSV reporting for supportive services for veterans families, SSVF, to the VA. That will continue. We're reporting now via CSV 4.1. That is out and been posted on the HUD HDX, which is where the CSV specifications live, and has been there for quite some time, and the vendors have actually had it before it was posted there. So it should be all ready and available to you. You will use that new 4.1 the first time in November for both SSVF and the Runaway and Homeless Youth Program data exports. The SSVF export has not changed except to be updated to the 4.1 standards. You saw there were two new data elements in the critical changes that directly related to SSVF, and those two elements are now carried in the new 4.1 export, as is data element 3.17 that changed, the chronic homeless length of time on the streets in shelter or safe haven element. The CSV 4.1 also contains the detailed information on the algorithm that RHY will use to de-identify the clients in the RHY export. So unlike SSVF, where the name and social and date of birth of the veteran gets transmitted to the VA, none of that private information on a youth gets transported through the CSV export to FSV, to HHS. So what goes in its place is an algorithm that is clearly specified how to program the algorithm that, to their credit, the HMIS vendors collectively developed. So the vendors had a subcommittee of people that do programming for a living, and really the best and the brightest of them sat together and worked several hours to figure out what was the way that they could do this across all HMIS systems, and then they put out the standard for that. So it's a standard that we believe that every HMIS should be able to meet, since the HMIS vendors created it themselves, and should replace any identifiable data for a RHY youth. And so no RHY youth should identifiable information should be contained in the extract for RHY. That extract is expected to be in November, and it will be for the entire program year, which would be the federal fiscal year period. Are there questions about CSV?
I haven't seen any.
Karen is telling me no. So we have some great news from the Veterans Administration to share with you. Oh, it's not?
No, we're on system.
Oh, we're on system performance measures. Wait, you have to do system performance measures before we go to great news. We just want to share with you the same thing that HUD has shared at conferences now. We know they said it at the National Alliance and some other places that the SNAPS folks have been, and they've said it to the vendors. The system performance measures are not required to be programmed in your system for the upcoming Continuum of Care grant application. So you do not need to call your vendor and ask where those performance measures are if they're not yet available to you in your system. You don't need them for this year's competition. I do understand you need them for lots of other things, but for this year's grant competition, you do not need them. And vendors have been asked to have those all in all the systems across the country by January 1st of 2016. So if you don't have your performance measures in your system yet, you should know that they're coming, and you should know that HUD has asked for those to be there for you by January 1. But I think the really good news or important news is that you're not going to try to show them in this year's competition and have to worry about something that you haven't even seen and haven't been able to do any data quality control or assurances on or fixes to look at the data, and all of a sudden it goes in a grant application. That's not going to happen to you. So I think that's a good thing. And then we're down to special news from the VA and HUD. Maybe you have heard the VA has issued national guidance to support the local requests for read-only and direct entry access into HMIS. What does that mean? It means the veterans, staff persons that are at VA medical centers now can type onto the keyboard of an HMIS and enter data themselves. The guidance is intended to address any local VA medical center misconception around security, privacy, and support access requests that have been initiated by VA leadership. They are saying to them, you can have read-only access if that works for your community, or you may have data entry access if that works for your community. You don't have to worry about the security standards. You can have access for an HMIS. The guidance does not mandate that the VA use HMIS. It allows them to use it. They're clearly not telling VA medical center staff that they have to do double data entry. But they recognize that there are communities that have coordinated assessment or centralized intakes or other kinds of functionality in their HMIS names list for chronically homeless vets, where you're inviting somebody to housing from a named list, that it is absolutely completely beneficial to everybody involved for them to be participating. And so they have lifted any prohibition from the medical center staff for participating, and you can work with them individually on how that works out best in your community. They do want to share that HMIS does not replace the VA requirement for homes data entry. They can't go ahead and say, well, yeah, there's a rule that says we don't have to do duplicate data entry, so we're just going to enter into HMIS. No, that doesn't work. They still have to enter into homes. And all of this will come out formally to the community in a joint message that HUD and the VA are still in the process of drafting, but they wanted, the VA worked very hard to be able to get this out for you admins today so that you would have the information before community members and know what folks were talking about in the community. So I think it's good news. I think it clarifies a lot of things. We've asked, some hard questions of the VA. What programs are they talking about? Who are they talking about data entry for? And there are no clear determinations made on those kinds of hard questions. That HUD will keep talking with the VA, and they'll keep talking with us, and we'll get specific answers for you on that as time rolls out. But for right now, if they want to do HMIS and you want them to do it, then by all means go ahead and do it.
So somebody just wrote in a question, does this apply to the VA case managers for HUD VASH? So it applies to any VA staff, and we know that HUD VASH, that's been a particular challenge to try to get folks in, and at the local level, a lot of, depending on their VA medical center, depending on what their local kind of climate was, some localities and some communities have let us know that they have heard that they are not, they've been hearing over the years that VA VASH staff are not allowed to use HMIS, and this is the VA's attempt to clear that up. That there is no prohibition against them, like as Michelle said, typing on the keyboard and actually entering the data, and also getting read-only access as well. So it does apply to VASH case managers as well. So I want to, this is Karen, I just want to apologize. We're trying to answer questions as quickly as we can for those that we can answer, but for some reason the question function is not, they typically, the questions are submitted or shown on the screen kind of in the order that they are submitted, but it's not doing that today. So I've got like new questions that are mixed in with a bunch of questions that are already answered. So if I do not get your question answered, know that we do review these afterwards, and we will get you an answer one way or the other. If I happen to miss one, there are some on here that I think I'm just seeing, and they were submitted like 20 minutes ago. So we'll get you an answer if we don't get you one today. Before we see if anybody wants to raise their hand or anything, I think since we're done with the slides, there were a couple of technical questions about the eCart tool that people were asking about security and is it encrypted. can you give a little bit more information just about the security of the actual tool and if client level data is actually being transmitted, all of that stuff?
So eCart has no client level data, none, zip, nada. It only has the answers to the questions on what looks like an APR table shell. So if you said you had 100 adults, 50 of them in households with children, 50 of them not in households with children, it's only going to show 100, 50, and 50. Therefore, it does not need to be encrypted, and it's not encrypted because it's carrying no client-level data at all. It's a tool that will live on the exchange, be able to be downloaded by local communities, and be able to be used by HUD grantees. It will attach to their CAPER. They'll fill it out. They won't have to print out a report. They will attach, literally attach the completed eCart tool to their CAPER report, which is a report that's housed in IDIS, the way that a city or county or state makes a report to HUD is through a CAPER report, an annual report. This document will just simply be attached to the CAPER submission. The city won't have to open it up and type anything into the CAPER itself, and all of that information will then come into HUD.
It's attached in the Econ Planning Suite.
Oh, it's attached in the, I'm sorry, it's not IDIS, it's the Econ Planning Suite that holds the CAPER.
Michelle,
yeah.
a number of people just asked, and I guess we just need to be more clear, that this CSV export, which is specific for eCart, will not have any client identifying, like personal identifying data in there. There will not be client names, any of that?
Nope, nope, none of that. No client names. You can look at, if you're concerned about what's going to actually transmit, you can look at the APR and CAPER programming specifications. They carry in them all of the table shells for the reports, and they show the format that it has to leave the HMIS system in with the row and column numbers for the cells, and you'll be able to see exactly what's being transmitted, but there is no client level data coming out of the HMIS to a community, to a city, county, community government. There's none coming into HUD. Are there others?
No, not that I'm seeing.
Joel, do you see others?
Yeah, there's a bunch. Well, and I'm kind of trying to group them together mentally. So this is, let's go back to there were a number of questions that all came together about youth, about the differentiation in the age categories there.
Yeah.
If we want to roll back to that slide, Dan.
So I personally am always challenged by the youth questions because in my world, you stop being a youth when you hit 21 in adulthood, but that's not the way this seems to work these days. And so youth is collectively anybody aged 12 to 24. So yes, you could be in a adult shelter and be a 22-year-old and even have been discharged from the military and still be considered a youth because it's a straight age pull. It has nothing to do with status. So all it's saying is if you are between the ages of 12 and 24 and you were in a project that was funded by the continuum of care, for example, transitional housing, you would be reported then in the youth section of the APR. And we know that many of you have projects that are funded by RHY as TLP projects and HUD as transitional housing projects. It's the same project, it's the same people, and their ages 18 to 24 in those housing units. Those are the people that are going to be reported. But likewise, they're going to be reported if they're in a large permanent supportive housing project and you have single youth, single people in those projects. They'll all come in the report like this. If they have an adult in the household with them that's over the age of 24, they come out of the youth question.
Well, I know people gave some examples.
Speaking of groupings,
go ahead.
I was going to say, speaking of groupings of questions, for the good of the group, Michelle, can you address victim service providers and what the expectation will be for them to use the eCard tool?
The expectation is that victim service provider is using an HMIS comparable database, and that HMIS comparable database is going to be able to produce a CSV file that gets incorporated into eCard.
So there were a couple of questions about projects funded with different funding sources. Like one example was RHY and ESG. If they're set up as a RHY project, will they also be able to produce a CAPER? And they should be able to.
Yes.
And they will be expected to.
Yes. So if it's a RHY project, that a good example, because we have lots of them, is a TLP project or that's funded as transitional housing and as TLP. They'll come out in they'll generate this export tool for eCard, and they'll also generate a full 4.1 export with the RHY algorithm that'll come to RHY.
And there was a question about the RHY algorithm and whether or not it would be able to do unduplication at the national level.
We think so. The algorithm has been used and has been tested. Algorithms like this are used in some data warehouses and in other kinds of venues. So this is not something that's unique or first time done ever. To produce an algorithm like this is a fairly rigorous process, but a process that's often used in research and other kinds of work. And so we are, within some reasonable assurance, it will be unduplicated. Having said that, if your grantees took the approach of everybody was going in as an anonymous client in their RHY project, this is the moment they're going to get caught, because it is not going to work for that. So those places where grantees took the position of not putting in identified data as they were instructed by RHY into the HMIS are going to have problems here, which with their problem to work through with HUD, or with RHY, I'm sorry, not HUD. We've done everything we can do here at this point to help you as sysadmins get the word out to RHY that client-level data entry into an HMIS is expected. And this will be the point that RHY will be taking the data in to see that that's happened.
Okay, so here's a question about eCart and its availability, if it's going to be available When we say it'll be available for local communities to download, does it mean that any agency admin can download it, or will only be available on a COC level, in addition to being used by ESG grantees? It's available to anybody.
Yeah, it's on the HUD Exchange, so anybody could download it. It's a tool that's owned by HUD, was built by HUD, is owned by HUD. It doesn't have any proprietary rights to it. Anybody could use it.
Joel and Dan, unless you have some more groups of questions, I don't think I see anything else that we haven't answered or that would.
There have been a couple throughout with regards to who is actually responsible for uploading the data to the eCart tool.
Yeah.
The jurisdiction. So the ESG grantee is expected to upload the data into the tool. The HMIS administrator is not expected to have to do that. You know, of course, it's very possible they're going to call you and ask you for help, and to the extent that you want to or can do that, that's great. But it's the grantee's responsibility to get the data from their projects and upload it. If you are a community that last year took advantage of the option that said you could submit one report on all of your shelters, just put it all in one ESG report, that option is no longer available. Each project has to come in individually into eCart. So, and at the national level, they will be unduplicating eCart to some extent.
So to be clear to everyone, so the grantee, the HUD grantee, is responsible for uploading this to eCart and also collecting from their subrecipients or their subgrantees, the project level. So you could potentially, if you're an entitlement community or a state that has multiple ESG funded projects under your grant, you would need to collect those and then load them to eCart.
That's right. Just like you would have collected before a paper copy of some kind of report from each one of their subgrantees, they'll now collect an electronic report. I think the word grantee and recipient and subrecipient in ESG is confusing because the recipient is the same as a grantee, and the recipient or grantee, however you want to think of that, is always the jurisdiction. It's never the shelter. The shelter or the RH project is the sub-recipient or the sub-grantee, however you want to think about that. So the grantee recipient, the ESG uses the word recipient, is always the jurisdiction. So it's the jurisdiction's responsibility to submit. You'll remember it's possible that the same shelter could be funded by multiple jurisdictions. They could be funded by a city, a county, and a state, at which point they'll have to produce 3 of these special CSV eCart exports, one for the city, one for the county, and one for the state. And just to make life more complicated for everybody, those are probably all on different grant years because there's no standardization of what grant year cities, counties, and states are running on. So their grant years could be federal fiscal years, it could be calendar years, it could be any other kind of variation on that theme. And they have to tell their grantees what the reporting period is. So the E-card is always run for the operating year of that jurisdiction.
So, and I just want to chime in, there were a couple of questions throughout about, there was one project setup question about a day shelter, how to set up a day shelter, who's receiving ESG funds in your HMIS, and there's a question about what data will RHY grantees be expected to export or report on. So I just want to make sure that everybody that's on the phone is aware of the program manuals that were published back in March for all of the federal partner programs. So there's one for COC and ESG, there's one for HAPWA, one for Runaway and Homeless Youth, PASS, and VA. Did I miss anybody? I think I got everybody. So, and that's where you'll find all your project setup information, how to set certain projects up. There's tables in there. You can always submit a question on the help desk if you have a very specific question about something that's going on maybe in your community that's not reflected in the manual. But I just wanted to make sure everybody was aware that the manuals were there, and they should provide what you need, guidance that you need to help you understand how to set projects up so that the reports are generated properly. So Dan and Joel are there. I'm thinking at this point we have a half an hour left, unless there are some other kind of general questions that we want to address. I think we've covered most of them. We might want to just see if anybody wants to raise a hand, and we can unmute them and ask questions since we have some time left.
Sure. People actually did a pretty great job of linking themselves up properly, so that actually shouldn't be a challenge this time around.
Okay.
Oh, I immediately have a question here. All right. I apologize. I don't know how to pronounce your first name, but you've been unmuted. So go ahead.
Okay. Hi. This is Steve Wolf from Project Home. I just have a quick question about the veterans. It says that you must be 18 or older at time of project entry or report start date, whichever is greater. So if we have a client enter who's under 18 and then joins the military after turning 18, would they not count as a veteran in the report?
I'm sorry, I could hardly hear you, but I think you asked, could a veteran be under age 18, and the answer is no.
No. If someone enters the program under 18, so as a child,
okay,
and then they join the military after they turn 18,
yeah,
would they count in the report as a veteran?
Yes, they should.
Okay.
And we moved the veteran in the 2014 data standards. We moved the veteran to be a kind of a funny one-time only field. In general, it's like name. It doesn't usually change. But just like there's an exception for name because somebody got married and changed their name, there's an exception for veteran that you can go in and change them from non-vet to a vet. Are there other questions, Dan?
Not yet. So if you, on the right-hand side of your screen there will be a raise hand option if you want to ask a question verbally. We can hang out here for a few minutes and see if any more questions roll in. Beverly, go ahead.
Hi, my name is Beverly. I'm calling from Colorado. We need some discussion around the RHY programs and an open system and what they can or cannot share.
Yes, we know. Thank you. We actually are aware of some, I think, miscommunication that went out, or maybe some misleading guidance that went out over one of the groups through the Runaway and Homeless Youth Technical Assistance Provider. We actually just had a quick conversation this morning with them. They are trying to kind of regroup on that message. For those that weren't privy to it, I don't think it was a national blast, but I think enough people were on the thread of the message at a national level. They pulled some data people were asking about. We know that there's still a lot of confusion around consent, getting written consent to share data, how that, are you allowed to share as a youth provider? All of that kind of, is still very unclear to a lot of folks, and we need to get some better guidance out there for you all, both HUD and HHS. But there was some guidance that went out that basically said that runaway and homeless youth providers should not be using a quote-unquote open HMIS, and that is just false. It's wrong, and RHY realizes that was not their intent. That was not the message that was intended to be sent, and so we are trying to work with them to get that retracted. So my guess is that's probably why you're asking the question, because you might have seen that message. So it was nobody's intent to tell runaway and homeless youth providers that they cannot use an open system, or that they have to go to their community and tell their community that they have to make their open system a closed system in order for them to be able to use their system. But we do know that we need more guidance around data sharing and consent in general, and also very much so for youth. RHY does have some guidance in the works that we are trying to work with them to get out, as well as some FAQs. And one of the things that I'm hoping to do later this fall, after we finish the September, like the third, I guess, part of this summer series, we want to start meeting with you all on a monthly basis, and rather than us taking an hour and a half or an hour and presenting to you, we want to have some more open discussions around some of these challenging issues. And one of the first things that we have slated for October and November are to bring our federal partner program staff and TA providers onto the calls with you, so that we can have discussions around these things, and you all can ask them questions, and HUD will be on the phone as well. But we are in the process of getting some guidance together, and I will let them know that this was brought up on this call today as well, so that they know it is a big issue in communities, and that folks really do need the guidance around data sharing and use, and what's allowed to be shared and under what circumstances, and all of that.
Let's go back again, though, to make sure that you're clear how a setup for a RHY project should happen. So if you recall, if you were on this conversation or other conversations, we've asked you to remove any requirement for assigned consent in order to enter data into a RHY project. By statute, all persons that are served by RHY have to be recorded in the recording vehicle, which at this point is HMIS, right? So everybody goes in. Now, the question becomes, who can see what went in? Clearly, the provider that's providing the youth service can see that client's record. Clearly, by the kind of national IT privacy standards, the data system administrator can see that record. You have to be able to see the record to unduplicate and do all the things that sysadmins do. So everybody knows that the sysadmin kind of person and the project level person can see the data. For clients that are in BCP programs, BCP projects, Basic Center projects, they're the runaway and homeless youth shelters. They're the runaway and homeless youth prevention programs. Those projects serve youth under age 18. They are not an adult. They cannot sign a consent for their data to be shared. There's lots of questions about, can a parent sign for them? Well, sure. Can they sign for themselves that they're emancipated? My state recognizes that. Well, yes. But in general, a BCP project does not share data and just should go ahead and set it up probably like you have set up your HIV projects, where that data just doesn't move. It's not shared. When you get to projects that serve older youth, the street outreach projects, the transitional housing projects, by definition, a youth in transitional housing is an adult and can sign a consent for their data to be shared. Can you just open the entire transitional housing project to the entire community to view? No, you can't. Can you open an individual record to be shared? Yes, you can. So again, we're moving from the idea that whole projects are open or closed, or whole systems are open or closed, and rather moving to a client-based, client-level consent that gives control for sharing into the hands of the client more than into the hands of system administrator or a committee of people that maybe as far back as 2004 made some rules. So the rules of the game have changed it to an individual level sharing, and that open and closed system concept in most communities doesn't even work anymore. There are very few communities left that are totally closed or totally open. There's lots of stuff in between, and so it's all the in-between stuff that's much more realistic today. We've asked the vendors to stop using the words open and closed, and we have asked the federal partners to also do that. It takes a long time to change somebody's language, but to the extent you can think about your system differently and stop talking about it as an open or closed system, we think that'll help you communicate with your projects exactly what's moving and what's being shared.
Can you still hear me?
Sure.
Can someone define for us what open and closed means? Because it seems like on the webinar that we had in July, there was some information shared about what could be shared amongst providers, and it talked about the basic demographic information, gave us a green light and said go. So there's still a lot of confusion, and we want to get this right because we want to protect the clients as well, but we need more direction.
Okay, yeah, good question. So when you looked at that green light go, that meant green light go if you got a consent form signed by the client. So in almost every system, you want to be able to unduplicate the clients, and oftentimes you want to be able to know, you want to be able to move client records from one place to another, and move some basic kinds of information, and not have the same person come in with 10 different Social Security numbers because everybody mistyped something. So that kind of basic client data with a consent can be shared. The next level is project data. That's where your community needs to start talking about, your community and your projects need to start talking about what kind of rules do we want around that kind of level sharing. So in project level data, we usually see things like income and the kind of program-specific data elements.
Right.
Do you share those? With agreements between providers and clients, yeah, you can. Absolutely, yeah, you can.
Okay. So what about the implied consent? You're talking about written consent, right?
Yeah, we're talking about written consent. We're not talking about implied consent. So we're to share data. Yeah.
The
now,
implied consent refers
do you want
more
to share
the collection of the data.
Excuse me?
I'm sorry, I didn't hear you.
The term, what you're referring to with regards to implied consent is not referring to data sharing. It's referring to data collection.
Yeah, I think we years ago we started to use the term either implied consent or inferred consent.
Inferred.
And that ties back to in the 2004 notice where HUD said that at a minimum you must have a sign posted at the data collection area that lists we're collecting your data, here's where it's going, here's who has, here's who can see it, this is why we're collecting it, that sort of thing. And we provided some language way back when, and folks did that, but then they also kind of went a second step, and many did, and started developed their own form where they were actually, in addition to that posted sign, that inferred consent sign, they were also getting written consent to collect the data. And that's where we've asked folks to kind of take a look at what they're doing, look at the 2004 notice, see what the minimum standard is, that it's an inferred consent to collect the data. But then when we're talking about releasing that information in a system where it's shared and sharing that data amongst providers, that's where we have to get the written consent.
And it's written consent of the client.
Thank you.
And so I would be curious, and you don't have to all raise your hands and jump on the phone, but you can just type in through the question box. But I had a couple of people write in, even as Michelle was talking about the definition when the caller asked to define open and closed, and a couple people wrote in and said, we need to have more discussion on this. That's not how I define open or how we define closed or that sort of thing. So I think that that's something we hear you guys. We know that this is, just know that this is not the end of the discussion with you all. I'm definitely interested in hearing what you all, kind of where you all are and where your communities are and what your understanding of these different types of systems are. Because as Michelle said, we've kind of come to the epiphany here in HUD that we really do have to stop using this open-closed term. I think it served a purpose a while ago. I don't think it serves much of a purpose anymore because, as Michelle said, so many, I would hazard a guess that there are very few systems that if we came up with the definition that we all agreed on exactly what an open system is versus what a closed system is, I would guess that there are very few systems that would exactly meet any one definition of either of those two things. They're just so black and white. And I think as HMIS has evolved over the last several years, people realize there are things that need to be closed in the system, but there are also benefits to sharing pieces of information or certain, project information. So I think that we definitely want to continue to have this conversation with you all around open and closed. It's not, this is not the end of it here today. So just know that we hear you all, and we'll continue to consult with you guys and hear what you all have to say so that as we're trying to kind of change this thinking, which, as Michelle said, it will take some time, and trying to get people to kind of stop using these terms that we think might be adding to some of the confusion. We want to make sure that we're all kind of speaking the same language, but it's also helpful to know kind of where you all are coming from as we talk about another way, I think, to characterize systems and to stop kind of, trying to very narrowly define something that really just doesn't fit a very narrow definition anymore.
Yeah, Karen, I think it's also worth noting that, and the reason we even brought it up in July, because we had talked about this before, whether we should bring it up or not, and we ultimately decided we should because there will be the privacy and security standards will maybe be out by the end of the year or next year. And obviously this all ties into that. So we're glad people have questions because we want everyone thinking about this and how, ultimately those new privacy and security standards might impact your systems.
Yeah, absolutely.
Do we have other questions?
I have a hand raised here, but I can't unmute her because she hasn't entered her PIN. Margie, if you can enter your PIN, I'll be able to unmute you. And to the people who are asking when this information will be posted online, I promise I will do it as soon as humanly possible. I'll be leaving for vacation in about a week, so that's my maximum threshold of time that it should take.
People don't want to know about your vacation plans, Dan. They just want answers. Yeah. So let's not.
Well, and just, you know, to back Dan up, I mean, if Dan or Joel or Michelle had their way, they would hit a button, and within 10 minutes of finishing this call, everything would be available and online. But
indeed,
you know, the federal government has to, you know, institute such a lengthy, layered process of moving anything forward that trying to get stuff online is it's quite excruciating, surprisingly enough. So these guys try their hardest to get this stuff ready for you guys and get it online, and then it gets into the bureaucracy here at HUD and our contractors that manage the sites for us, and the process that we've instituted is really just quite maddening, to be honest. So we have to go through this process to get the stuff up. That's why it takes so
long. Karen, I am noticing one other thread here that I think you can address quickly, Karen. Everybody's excited about this announcement. A lot of people are excited about this announcement from the VA, and they're just wanting to know. I think you said, Karen, to us before that there's going to be an official announcement,
Yeah.
probably going out on the listserv, and it's a joint announcement from the VA and HUD about the you know, to clarify that the VA staff can use HMIS. And I think people are, I think people don't believe what they just heard, and they want to be able to put their hands on something.
Yeah, no, believe me, we completely understand, because we've been hearing, you know, kind of hearing this from different people at the VA for over the last several years. Well, we don't know why people won't enter data. Of course they can, and this has really been the first time that somebody at VA at the national level has been able to get somebody from their privacy office to actually put pen to paper and agree that they can say this kind of publicly. So the process that, and I apologize, I can't remember if Michelle went over this detail, but basically what happened was when we found out about this, about, I guess it was the end of July, beginning of August, we found out about that this was actually happening and the VA was actually going to publicly say this at the national level. We talked with them about it. We said, like, this is great, but this is going to open up, you know, there's going to be a bunch of questions about this, and there's going to be confusion around it. So are they requiring everybody to use HMIS now, or is this now saying that they can? And so we were trying to anticipate a lot of the questions, and that's why we're still working on the listserv message that will come out jointly from HUD and the VA. So the VA did release this to their mental health leads and their homeless network coordinators. That was kind of their first step in releasing this internally, because they wanted to kind of get the message out there internally to their VA staff, but they also wanted to hear what some of the questions were going to be, or where, if there was any confusion, so that we could use that to inform the bigger message that we're going to send publicly. I believe we learned this morning when we had a check-in call that they've also let their VA Medical Center folks know, so they're kind of incrementally getting it out there to their VA folks, and we hope to have the listserv finalized within the next day or so. That will go out. I will also be working with, as I mentioned earlier, we want to bring some of the VA TA providers and some VA program staff possibly on a call with you all, you know, hopefully maybe as soon as October, to have a call with you all to talk about this. Let us hear from you. I'll let them hear from you all what you're hearing. If you're still experiencing resistance, they understand that this is all not just going to, we're not going to flick a switch and everybody's going to understand and be on, you know, and using HMIS. We're still going to have pockets where the message may not trickle down, or people just really, like Jill said, don't believe what they're hearing or seeing. I also have a plan to have our regional technical assistance teams reach out to communities in a couple of weeks to see if, you know, if they're meeting resistance, if they've gotten the message at the community level, if they have VA projects, approaching them about, you know, starting to use HMIS or get read-only access to HMIS. We're also going to be working to update and expand the VA program's HMIS manual as well. So we've got a lot of pieces to this, so you will most definitely hear more from HUD and the VA. There'll be a public message We definitely are open to suggestions around trainings and other conversations, but we want to include you guys, again, have a conversation with you all specifically about it, and we are going to keep engaging, trying to engage communities through our TA providers so we can identify anywhere where maybe the message didn't trickle down or people are having difficulties trying to convince folks that this really is like kind of the real deal this time, and people, VA staff really can use HMIS once and for all.
I guess I want to follow that up too by saying that the slide, and I don't know if they're still up, the special news from the VA and HUD slide that will show up on the HUD Exchange is the words that the VA wrote to us today to be able to share with you. So we haven't edited, we haven't changed. We've literally put up their words to you.
All right, Michelle, Margie has been very patient. I'm going to unmute her and let her ask her question here.
Thank you, Dan.
Go ahead, Margie.
Thank you so much. Yeah, I know we've kind of moved on past the sharing, and I don't want to. I know you guys are going to put out some guidance, but I just wondered if you could address real quickly. What about verbal consent, like over the phone? Would that be considered a form of consent? And then the second question, which may be more in depth, so that might come later, but in terms of the definition of sharing, is sharing defined in terms of sharing between programs, sharing between agencies, or some different definition?
It's sharing between projects is what it's defined as at this point. Between projects in different agencies. So I've been real specific and asked, like, if there were 3 BCP shelters in the same community, do they kind of by RHY rules have the right to open their system and share that information across those 3 shelters? And the answer was no. So it's a project level consent. A person in a project must consent, and at this point it is a written consent, and it's not a telephone verbal consent. Now, how you do that, how you operationalize that, we understand becomes an issue for you, and you're going to have to. There's going to be lots of work out on all of that, and what's actually allowed or not allowed. At this point, it's a written consent.
Thank you.
Mm-hmm.
All right, those are all the hands that are raised.
Okay, well, I think then we'll probably, as I said, I know there are questions that we did not get to on the that you folks wrote in the question box. We will review those. We will try to get answers out somehow. One person actually wrote in at the beginning and said that it seemed like folks were actually submitting, some pretty good questions. I think that probably a lot of folks, you all can typically see the questions, but they had proposed possibly trying to summarize those questions in some way and get responses to you all. So we'll look at what our possibilities are around, doing that after these meetings. But if we didn't get to your question, we definitely will try to get you an answer one way or the other, and we'll go ahead and wrap it up for today. I want to thank Michelle and Joel and Dan. Have a good vacation, Dan, and we'll talk to you guys at the end of September around performance measures, and you will also hear more from us around future meetings after the September meetings. If you have not registered for the September meeting, please remember to follow the instructions. Register for the September call. I believe it's September 23rd. Is that the call? Is that the date? Yes. At the same time. So please register, and we'll talk to you all some more about in the future about the future meetings, because we definitely want to continue to communicate and talk with you all on a monthly basis. So thank you guys for participating. Have a good day.